order. Discuss possible action on the May 22nd meeting minutes.
We're in the same district.
I would entertain a motion.
Okay. Yeah.
Do a motion to approve the meeting minutes as presented for the May 22nd meeting.
I will second it.
I'll second it.
You second it? Okay. Any further discussions about changes or anything? All in favor of the motion signify by saying aye.
Aye.
Opposed, like sign. Motion carries. Thank you very much. Financial report, Brenda, please.
The financial report that I did this month, excuse me, is just the first half of 2018. I've highlighted a couple June things, but most of it is the first half of 2018. The first item to note is that salaries and related costs, so health insurance benefits, are $78,000 less than budget for the first half of the year. And as you know, that's due to vacancies and unfilled shifts at St. Croix EMS. 28,000 of that 78,000 is health insurance, and that's because of the vacancies. So we're 50,000 is salaries and bennies, but 28,000 is health insurance. The vehicles and equipment repairs for the first half of 18, they're less than anticipated, so the contractual services are less than the adopted budget. As you know, that's something that we can't predict for the second half, but right now it has a positive effect on the budget. Call volume, as we've noted throughout the year, call volume this year is down at 7.3% lower than 17, and then 6.9%, 7.3 less than 17 and 6.9% less than the adopted budget. If we were at fully staffed right now, then that would be more of a concern of the cash flow. But because we're not fully staffed, that call volume reduction, we're able to cope with that at this point. I don't have answers as to why call volume's down. That's something that Brandon can answer better than I don't have access to that data.
Stand on the highway and see if you can get some more business, would you?
It is. It's just,
Yeah.
it's been
Nothing
quiet.
you can really do about it.
No.
It's an estimate, is all it is.
Yep, it's an estimate, and as long as we're not turning down calls, it's
But when you're on
explainable.
that, since you're discussing that, I did have a question mark on that.
Yes.
It's 7.3% lower than last year and 6.9% less than anticipated budget. And yet the discussion in my mind that draws discussion was Ray saying, how did you anticipate that our growth in calls was going to be 8% more? How can it only be 6.9 if we were supposed to have an 8% growth?
Good question. It was because of, we're just looking at the first half of 17.
Oh, okay.
And so when we looked at the budget amount, that's for the whole year.
Okay.
And we just took half of it.
Okay,
So, yeah,
okay.
I had the same question.
I'd just like to bring up too, at our last meeting, we talked about getting some information around who actually is generating the calls, and are they following a decision tree? Is there some type of, who's generating the calls, where are they coming from, and that type of thing. If we can better understand that, that will help, I guess, strengthen our prediction models in terms of how many calls are we going to get, who are they coming from, and that type of thing. Because that's really the bread and butter between, or at least behind, not only our financial models, but how we're performing in terms of how many calls are we getting, who's making the decision in terms of where those calls go to.
Right. And I had mentioned the policy that was being drafted for the transfer side of things. I'm not sure if it's been implemented on the hospital side yet.
Okay.
I did see a final draft, but I don't know if the powers that be there have implemented it yet.
Because I do, maybe if I'm repeating myself, I think that would be exceedingly helpful if we're able to know what are the rules of engagement in terms of who's deciding, who gets the calls, is it per their discretion, or are they following some guidelines on that? And if we can get that to be more consistent, I think, then we...
Right.
Is that the one you were working on with the medical?
Yeah, yep. So he drafted it, and it's, I believe, in the committees up there yet. And as far as the 911 side, it's black and white.
Okay.
They get the call and
All right.
they just
I was
decide the
gonna
agency
ask you
whose
about
area it
some
is.
of that stuff later,
Yep,
but,
yep,
okay.
with that, it's really just whose service area it is gets the call.
Okay.
So,
Can you follow up with him and see?
yeah, I'll see if it's been
how it's-
implemented. And
How it's going and
Yep.
and if we see some results?
absolutely.
Thank you. Okay.
I'm at the bottom of page 2 in the memo that I sent out. The staffing in the new model, as you recall, a desired outcome in the new model was for the director to work less shifts. As you can see, in June, he worked the same amount of hours as last year.
That's working well.
And then year-to-date, it's, it's down a little bit year-to-date, but yes. So we haven't seen the reduction that we had hoped for in that. And then the payment amount for that stipend is on page 2. On the bottom of page 3, there's a graph of the FTEs on the trucks, and that's taking the paramedics, the casual paramedics, the EMTs, the director and supervisor when they are on a truck, and putting those hours and equating it to an FTE. For June, it's 14.54 FTEs compared to the budget of 16.85, so about 2 FTEs is what we're down.
I have a stupid question as I look at that. There's no way you would hit 16.85 people in your budget numbers. You just wouldn't. Because of the way you staff the trucks, right?
Well, to be fully operational, including admin staff and everything, we're looking at a proposal of a total of 17. So,
But you wouldn't with every level. That's my point. Whether they were paramedics, casuals, you know what I mean? Would you?
you should.
You should,
Think
yep.
so?
Should, yeah.
Because this FTE number, the 16.85, is looking at 365 days,
Oh, it is. Okay, so
Yep.
it's an average.
trucks, 24/7, yep.
Okay.
So just a quick follow-up question here. So if we were fully staffed, would we still be on budget? And then the second question would be that, given our call volumes, if we were fully staffed, would we then have idle capacity in terms of workforce? I think we should somehow find that
That's a good
equilibrium
question.
point,
That is a good question.
because we have to keep recalibrating our staffing to keep up with what our actual call volumes are.
Well, right. But to accommodate interfacility, we have to staff a minimum of 2 trucks, 24/7. So that's kind of where we're at. So even if we're down on volume, if we don't have that second truck, we have to turn down calls.
Yeah, there will always be that
Yeah.
idle time, if you will. And
Right.
Um, I was just, maybe just something for future consideration, I guess.
Correct, and we had been looking at calls per hour, and, we noticed between midnight and 4 a.m. that call volume isn't there, and so we talked about,
Right.
do we go down to 1 truck, and we haven't gotten up to the full staff to look at that again.
Yeah, when
But
you're
it-
looking at your model for interfacility transfers with the medical director, are there times when you don't do transfers at that same time?
It's kind of hit and miss.
It is.
It
huh?
seems like though those late night ones, middle of the night ones, are the higher acuity ones, the sicker people that need to go.
Oh, that need to go.
Because
so
the
you really
resources
have
aren't
to-
available,
Okay,
so-
I just thought I'd ask.
Yeah.
The other thing, when you're looking at that model, when you're fully staffed, what's your call volume potential? You
That's-
should calculate that so that you know what that number is as we budget. What level are we going to hit with 2 full trucks?
And that's what we were looking at for this year, based on the number of interfacilities that we had to turn down due to staffing last year.
Yep.
So
Okay.
that's kind of where that number came from for this year's projected.
Okay. Good discussion. Thank you.
Yep. And then at the bottom of page 3, I have that, I talked to Brandon, he has 17 EMTs currently in active status. 4 of these worked at least 24 hours per week in June. And then another 11 of these EMTs worked 2 shifts in June. And then the new requirement is to work 2 shifts per month. And so we've got just 2 that didn't meet those minimum requirements. And so that is an improvement over what we've seen the first half of the year, or January through May. So June did look better that way.
I got a comment just for the rest of you guys. We've been discussing for years, we can't meet our model with the staffing, and as a consequence, the budget costs are always low because we're never reaching our staffing levels. So we're always running in the red, if you will, on not having to pay out as much. And we actually were doing more runs previously, and one of my points when Ray used to talk about when we were having the 8% increase, how are we going to ever do that? I said, careful, just so we all understand. If we ever reach full staffing level, we've always been able to save on our labor costs, but if we reach that full level and we don't get the runs, we're financially in trouble. We're going to be behind because we won't have enough income coming in to cover that debt. Budget says it, you know. So just so we understand that as we're moving forward, and that's why we have to work on cost reduction efforts for the system. Okay.
I think it's an excellent point because it really is, it's fragile. It's very sensitive. If we're fully staffed, then obviously we're going to not be hitting our budget. But if we're not staffed, then of course we can't do the runs. And
yeah,
we're caught in this cyclical loop here.
Yeah.
That's all the more reason to pursue transfers.
That's correct. That's correct. Okay.
Any other questions relating to the financial data? Did anybody have any specific questions about the revenue and expenditures or cash flow?
Yeah.
Okay.
Where is it here? I know that there was an increase on page 6 in the month of June of 18 and was it? Yeah, May of 17. We billed out 203,000 basically, almost identical dollars. 148 was the runs this year and 177 last year. Is that all due to increase in our cost for billing for the calls? So you've got 29 fewer calls and same number of dollars billed in the same month 1 year later. So is that all, or is that also partially the call type?
It could be the call type. I mean, I'll look at that, the call type. I've got that in a spreadsheet and let you know. I would suspect it's both the call type and the increase in rates. And so, as you know, a BLS call is, we have less revenue than an ALS call. But I'll take a look at that and I'll send an email out to the committee.
And the only reason for looking at that and wondering is if we don't have as many calls, we may not be pictured having such a bad year if that rate increase covers part of that. That's my question, why I'm asking that.
Okay.
Okay. Anybody else have anything with those numbers? Otherwise, thank you very much.
Okay, thank you.
Ad hoc committee update and discussion.
Okay, so the ad hoc committee has put together Jim and I put together the presentation on the next steps. So Jim will start.
For a lot of you guys, some of us are going to be rehashing what you've lived with for several years. But we're trying to summarize as much as we can what we've heard and tried to assimilate over the last 8 months to create a picture, a different picture going forward. First of all, we've received an inordinate amount of input. I've got stacks of paper of stuff that some of I've read, some of I've looked at most of it I've looked at what were the conclusions, and tried to fit it into what we have. We've heard a lot of opinions from a lot of different people, different ways they think it should be done. And this is just a list. I mean, you guys are certainly your meetings have been an integral part of that, hearing how you're dealing with this on a day-to-day basis and the issues help us build a picture of maybe how we can move forward. So the calls or the information has come from meetings like this, reports that we've read, conversations in coffee shops, on the street, phone calls, emails, concerns that people express. So it's just this is just a whole variety of things. We're hearing from a lot, and our meetings have been open, advertised, and we have people come in with presentations, very good presentations about how things could be, their perspective. We've done some consulting. We spent some time with the Lakes Region EMS as we see as a successful organization in terms of running an EMS service, and want to just talk with how they do things, what they're like, what their whole structure is, and it's very interesting. They're a nonprofit and they're financially stable. Safe Tech Solutions. John Bucknell is a national expert on and does a lot of consulting on EMS issues, and these things are all free. We're just calling people, and they are volunteering a lot of information that they could be charging us for, and if we end up working with them, they will be charging us for information. John is quite well versed and offered us several comments and followed up, said, hey, here are some things that you might want to look at, how you proceed, what information that you need to put together. Mueller Communications and the City of South Milwaukee, they did a referendum on their EMS, or on emergency services, and it was a study in community engagement and how getting the community to support the referendum to raise significant dollars for their services. And we talked with West Central Regional Planning, looking for some resource there that would be perhaps one, understanding our issues, the West Central Wisconsin issues, but they didn't have any real resource that they felt was knowledgeable, able to support us in coming into the process with knowledge about EMS service. And they recommended Five Bugles, who is one of the companies that we work with on the fire department. So they're another source, but we have not talked with them. I spent some time with Dave Madison, who's the interim director at River Falls EMS, after they'd had an assessment and they had some changes down there, and he was the interim director, and we talked about how might we partner together. It was one of the things. What have they done to help address their problems? How is there a partnership, availability, or some difference in how we operate together? Talked and I'm speaking. A lot of this is Joyce's conversations as well, but Tracy Habashaline, who managed the community engagement process for the school in passing their referendums, and Carol was their consultant, and we've also had conversations with them about how we do this piece of that. I think that was one of the things that was perhaps missing in the exercises we went through 2 years ago in working with Lakes EMS. That community engagement process obviously failed. It wasn't there. So we're seeing that as whatever we do, no matter what it is we do, we're going to have to do that. Otherwise, we will have the same issues, the same people, not different people, pointing out different solutions. We also looked at the strategic plan of the EMS service. We looked at the fiscal analysis. We looked at service structures that are existing, other ways of doing this, or the multiple ways. We call structures, we call the way, as for definitions, is the how we deliver whatever service it is, whether it's a hospital-based ambulance service, a police or a fire EMS service, where they're both they combine it into one service. Profit, facilities, nonprofit facilities, a municipal organization, which is probably where we most fall into in that definition. And then there are combinations of those structures, private municipal, nonprofit municipal. So there are a variety of structures, and we tried to examine those. One of the things that came out of that is that we collectively do not know enough about how some of these operate. All we can do is what we read or what we hear. If I go into and look at a blog that promotes fire EMS, they promote nothing else. It's just strictly focused in that direction, and I know some enough to say, well, they're ignoring the weaknesses, so we don't have a good advantages, disadvantages of the different methods. We also studied the assessment. River Falls had just completed an assessment of their service. St. Paul had done that. There were a couple in Minnesota, Lakeview and Lake City and Plainview, Minnesota, that had assessments done because they're in the same situation, perhaps even worse. Their situation is even worse than ours about how they might address those. So we're just looking for information about what other people are doing, what are they finding, and what are choices out there. Some of the and these things, the financial issues, you guys know very well, that the Medicare and Medicaid reimbursements are significantly lower than cost of service, 25 to 50% less than cost. We looked at there is a possibility. Some states are participating in a program where they get reimbursement additional reimbursement from Medicaid, and ballparking $200 a run, which would be a significant increase, almost double our Medicaid payments, maybe $40,000 a year. But right now, Wisconsin is not participating in that, and we're asking our state representatives to look at that. And Medicare runs have continued. You can see the pattern if you go back about the increase in Medicaid runs. It'd be kind of more and more a significant part of our volume. Our costs continue to rise, partially due to costs are just going up, but also our services has become more sophisticated. We have to you have to look back maybe 10 years and see the change in the sophistication of service and what we're able to deliver and what we're able to do. Inter-facility transfer runs are important, and I heard that several times this morning, that this is critical for us to be able to do that. And levy limits, particularly for our partner municipalities, but even for Hudson, are an issue. We have a limit as to how much we can tax. We believe, and this is our perception of what the community wants, that they want a reliable service, and we have a definition of what that is. They want accountability. They want community ownership, and that has a lot of different nuances as to the meaning of that. They want financial stability. They want to be able to see in 5 years out the costs are not going to be way up here, or we know what they are and we know how we're going to meet that. They want a stable community subsidy, and that's particularly important for our partner municipalities. And high employee engagement.
Okay, and on that slide, we're missing affordable billing rates. That got cut off because of the.
I'm going to see that.
That is one of the things that happens that when you look at different structures, sometimes the community cost or tax piece disappears, but the billing rate goes up in compensation for that. So it still costs the same. Well, that's not quite true. There are ways where it doesn't cost as much, but the cost could disappear from the levy rate, but actually end up in the tax. Whoever uses the ambulance service is going to see that cost. So that's the thing, that's the number, when we read all about these things, that seems to be the hardest to visualize or to see. We don't have the access to that data. And what we, a model that provides reliable service. And this may not be the only model, but this is one that we think is a functional model, and it's one that we're attempting to move to as I see our plan. We have full-time on-site staffing of 2 ALS ambulances 24/7. And that'd be 1 paramedic, 1 EMT per ambulance with a 48-hour work week. That's 7 paramedics and 7 EMTs. These are all FTEs. And we would still need casuals for backup, for vacation, for sick, for the 3rd ambulance, which we've used several times this year. So we're still, there are times when we cannot fill, even with a full-time staff. There are going to be some times we're still going to need the casuals. We still need that quasi-volunteer workforce that has supported the ambulance service so far. What else is cut off there? Something is cut off. Can you?
Just the 3rd ambulance.
Okay. We've also learned, and I apologize because most of you know this, but our wages and benefits are not competitive with metro area employers. I got some feedback or pushback from Devin that our benefits were better than others, and I would respectfully disagree on a total basis that our benefits are better than metro area benefits.
We have always, whenever we've had discussions with the employees, been told we will not budget to the metro, and we will not check with the metro. We will budget based on what Western Wisconsin is. And so really where we're looking at is New Richmond and Baldwin, and that's where, and we've always had that discussion, Jim.
Right. Yep.
So when the employees tell you we're not there, that's a pushback from the city.
Oh, absolutely.
You know what I mean? And so,
saying,
and yet inviable to the city, it's a cost if you increase it to that level.
Oh, absolutely.
You know?
Absolutely. I mean, I know that. And I think we all know that, but this is this is information. This is why we're having staffing issues. Part of why we're having staffing issues is because we don't compete and perhaps can't compete. The volunteer and part-time models are no longer working, and that's a nationwide finding. Everyone we talk to that has experience in this and is looking at it from either first-party, second-party, or third-party perspective, the volunteer model is no longer working for EMS. It cannot fully support the kind of structure that we have in the area we're in. There are a lot of reasons for that, and we can talk about that, but it's the job has changed from when it started to bandage and carry to save a life in the process. I don't mean to be disrespectful, but that's a way that I see that. Each structure, as we looked at, is what we could learn and what we could derive and try to analyze the viewpoints as advantages and disadvantages in cost and coverage and economies of scale and degree of local control. There are a variety of ways of doing this. Our model is if you call ours the pure municipality model, is not the only way to do this. It's being done in other ways. But you may give up something in the process. So path forward, is this yours now? Mm-hmm. All right.
Okay, so we see the need to complete the cost estimates for the reliable service model, so where we've got 7 full-time paramedics, 7 full-time EMTs, using wages at the current rate, but then we need to do the numbers for a competitive rate so that we see where we're at, and then convert that per capita rate to property tax rate per 100,000 in value, so that we can see how this would affect each homeowner's property tax. So we're asking to authorize and fund the analysis of the structural and organizational options, and so that we can see the benefits in service, control, and cost. So we also need to utilize the community engagement process. We need to find out what the community really wants. I mean, all of this information that we've got here is based on what we've gathered, but we need to have a process that is really going to get out and gather information more aggressively so that we've got a better idea. And then and find out what the community is willing to pay for the service. And then, based on that, decide where we're going to go.
An important part of that piece, sorry, Joyce, is that it's the information starts becoming from people have information about what the choices really are, what the advantages and disadvantages are. Right now, it was a lot, from the 1,200 signatures on the petition that said, "Do not sell this organization." Some of it was from really informed positions. Some of it was from, we love St. Croix EMS. They've done a great service for us, and we want to keep this model. We may not be able to totally keep this model. So, there may be some changes to it and how we do that. We may have some partners in this thing. There are lots of, when we look at it, there are options that we need to explore that we have not fully explored. If the first option was a choice and it wasn't fully explored, it wasn't community engagement didn't happen properly, so it just wasn't handled well. We don't want to do that again, because we can't afford to do that again. So that's why this community engagement part is important, and we have to provide information to people as to what choices they have, not just this is it, this or that, and based on incomplete information.
And we need to retain a consultant to do that community engagement process properly. I did talk to Ann Carroll, who was the consultant that the city or the school district retained for their community engagement process, and she had a lot of. We talked for 2 hours, and she had a lot of advice and information on how to proceed with this. But I think that doing a study of all of the different structures is going to be critical. And then here are our ad hoc committee members.
Any questions?
Yes, our last meeting, I believe Tim asked the ad hoc committee if they might contact our legislators to see if there's any bills in the works to make EMS an exception to the levy. I was wondering if anything has happened on that.
Yes, they could.
They do that with libraries. They could do that with emergency government costs.
Yeah. Trying to remember now. I did contact. I didn't hear anything back from anybody that I contacted.
And why they don't want to do that, I haven't got a clue. Because I talked to Sheila about it too, when she was still our representative.
Well, we got to keep asking. This is important.
Have you contacted our current senator?
Yes.
And she hasn't gotten back? Or our staff hasn't gotten back?
I'll go back through my notes and see what I've gotten, but I don't know that I have gotten anything back on that one. So let me make a note of that.
It's, she was an EMT, taught EMTs,
yes,
and has a lot of experience in this area. So she, there may be other legislators that she knows of that are. We have the same problem probably all over the state.
Yes.
With EMS.
Amy Louderbeck, is that her name, from Clinton? She's also well versed in EMS issues, and so I suggested that Patty talk to her. I also talked to Katrina Shanklin when I was at a conference, and she was present. She represents the Stevens Point area, and I talked to her about the issues, and she was supportive as well. I told her about the Milwaukee paper that talked about the money that's available from the federal government to supplement the Medicaid. And she said that might be something that that the legislature wouldn't even have to approve, that could be done through one of the departments, and that she was going to look into that. So I will follow up on those.
I'd just like to say thanks for the information. If we're going to make informed decisions, and we need somewhat of a roadmap, if you will, to move forward, this is key information. The one point I think that you mentioned that really has me thinking here is the definitive statement that volunteer and part-time models no longer work. And if indeed that is the case, I think that needs to be, it merits more discussion in terms of our model, because that's a game changer. That changes how we staff, it changes everything, the financial models, et cetera. So I would encourage this group to really take that feedback to heart. If indeed we're asking for the feedback to do something with it, or we're asking the consultants, then we need to listen to what they're saying. And if they're saying that those models no longer work, we got to take that to heart. And I think it merits more discussion. So maybe I'm stating the obvious there. I had another thought in my mind. Maybe it'll come back to me.
If I can, we presented this to council on Monday night. The preferred steps would have been to talk to you guys with public safety and go to council. We wanted to get this, we need to jump on this, because you guys are going to say, what's the council think about this? We've had that response from you before. And so it was just on a discussion point. But I think, and Bill, correct me if I'm wrong, but what we got was support for doing the structure work, to come back next meeting with a proposal, definitive proposal on who, how, what the cost might be, to actually look at what structures are going to fit this area. What works in Minneapolis, St. Paul may not work here. Absolutely won't work here because of the level of professionals that we have, or they already have on board.
Well, and at the pay that you're paying here versus there.
Yeah. So it's so we have to look at those, and we need, and we all have opinions on it, but I know that my opinion is worth nothing compared to anybody else's out there, because I'm not an expert in this. I don't have a background. I have what I've read, so I'm informed, but I am not the source of how we should do this. So I finally come to grips with that. I don't know. I have some things I see that look really attractive to me, but I think we need to be able to step back and just have this look. So that's our next step.
Yeah, and we need a neutral party to look at all of the options for us and give us a summary of them. And then Ann Carroll, the community engagement person that I talked to, said that she thinks that a good idea would be to have a consultant start gathering information, and then we do some community engagement work with that information, and then go back to the consultant with that community engagement information and ask the consultant to refine things based on the community engagement information.
What's your timeline on this? How long do you anticipate it's going to take?
It's going to take
for which piece? Beginning to, I think, well, I don't have anything definitive on that. I would say, the consultant on structure, 60 days or less.
Once we've got somebody hired.
Yeah, once we get into that.
And that's going to take, what, 60 days to,
that
or
could.
more?
We'll have to see. There's.
I do have some information. I don't know if we want to wait until the next line item in the agenda, where we're talking, but we reached out to River Falls, saw how long they took in their study. I guess we could just talk about it now too, but so theirs took 4 months for their study at a cost of $34,000. So we would kind of,
That was a little different study, though. That was a study of their operations and how they might improve their operations. We're looking and saying, what, you're right, it will integrate with that, though. What structures might fit our operation? I'm hoping that you guys have the financial and use information that you're coming up with now is going to be very valuable for whoever is looking at this. This is our situation. I think we have a pretty good picture of that.
And Bill, how did they fund their study?
what's that?
How was their study funded?
That I'm not sure. Did you get?
I don't know if it was, are you asking general fund versus the EMS fund?
Yeah, I'm just wondering where it came from. Okay.
I'm going to throw some ice on this. You've had 8 months to review everything. The original, what you set out to accomplish was to find ways to reduce cost. I don't read anything in there on what you're doing to find cost, that you found anything. You've done a lot of analysis. Now you're going to hire a consultant. You didn't think the city was not paying their fair share. Now you're going to ask EMS and the other municipalities to share in that cost of paying for a consultant that I don't see changing the result of where we're going, that we couldn't get there by just working with the model that we're working with for several years. I don't. And as a consequence, if you want to do that, my recommendation to this commission would be, if the council wants to do that, fund it through the general fund, but don't come back. In just like you said, you didn't do enough community involvement when we went to sell it to the hospital. And you build the EMS service for all that attorney fees, and what did we get out of that as municipalities? Absolutely nothing. And there's a sore spot in my mind here. At the end of the day, if the service would have been sold, the other municipalities had to go back and hire an attorney to do our own contract with the hospital because the city's was done. It wasn't even going to be part of that cost when it was split up. I'm sorry. I got a bitter taste in my mouth. I don't have a taste for spending more money for a consultant.
And I think that's why and we should have perhaps done it sooner. That's why the council voted 5-1 to stop all of that work. It was not going to be productive. That there was no possibility for that being productive at that point. So yeah, there were things that did not go well, and were not done. The end result was not good. So that's all we can say. My only thing is I wish that we had stepped up and said something 3 months sooner, and done something 3 months sooner.
That's okay, and I understand that. And I understand your community involvement, but the problem with the community involvement still doesn't get you to the bottom line that you got a levy limit. They can tell you that they want to spend the money, but you can't unless you take it out of someplace else or borrow money to pay it. You can't just increase it without doing something. You can't just raise talking to them to say, are you willing to pay for the service? They'll tell you absolutely are. But the state government says, no, you can't charge that.
And then that would come down to a referendum.
I can tell you where that'll go.
Well, the community engagement process would tell us whether or not a referendum would be viable. It was done in the city of South Milwaukee.
We tried to get additional funds to fix roads. And that was like shooting clay pigeons at the Rod and Gun Club. They were really good shots.
But
that referendum did not pass.
yes, I know that.
And it's just for fixing roads that people drive on every day. You only need an ambulance when you're really sick, and you hope they're there, but you don't anticipate that I want to pay more money for it.
But one of the things that when I talk to people about the community engagement process and running the referendum, and if you look at what happened with the school district and how they did it, they didn't just run a referendum. They did that community engagement process to get information on whether or not that referendum would pass, how much the referendum would, how much of a referendum would pass, and they utilized that information to develop their referendum. And that's what the community engagement process is about. And that's what the city of South Milwaukee did before they ran that referendum. And so it's not a matter of just running a referendum. It's a matter of
Do you
taking the
think,
time to do
I'm going
this.
to ask you a serious question, that you had an increase in the cost to every resident in this community for that school budget, for that referendum. We've had borrowing in all the communities to pay for their budget increases. Do you think they're willing to spend more money for EMS? I'm hearing people choking over the cost increases that they've seen from the school. You talk to your clerk, I'll bet she's getting phone calls constantly complaining about their taxes going up. And it didn't have anything to do with you. It had to do with the school taxes. But they look at what it costs them for their taxes for their house. And I'll be willing to bet you that probably 70 to 80% of them don't want to pay any more tax dollars. And it doesn't matter what your community involvement tells them that you can sell them on. It all sounds wonderful, but the bottom line is when you're at home paying your bills, you only got so much money to pay those bills with. Sorry, that's a reality of life.
So
That's what we've had to face here with our budget costs with labor. The city has said, no, we're not willing to pay what they're paying in the Twin Cities. And therefore, we've had to work around that. You know, I'm sorry, it's not a fun discussion, but it is. It's a reality.
Well, but we've got to have those discussions.
I know.
And we've got to have those discussions with the community to find out exactly what they're thinking.
Yep.
What
And
are
what
they
they're willing
willing
to
to do? Well, you can go and pay somebody to do it, but I don't think we ought to put it in the EMS budget to do it.
So Tim, wouldn't it be prudent for us to look at different structures? I mean, as it is right now, you're up against your levy limits. The structure that we're looking at, delivering the model that we want of the most reliable service, lowest cost, the things that we think that the community wants, wouldn't it be good to look at the structures that are available to us?
Correct.
Okay.
Do you think we've not done that with Brandon in the service? One of the complaints was, and I'm getting into stuff that's old hat, but there was discussions that Brandon didn't warn the employees 6-8 months ago well enough, or probably more like 10 months ago, and they beat him up pretty bad for it because he didn't warn them that EMS was not going to be the same operation whether it was with the hospital or when it stayed as St. Croix EMS. It was going to change. And it has. And why? Because we need to change the model to move forward to the needs of the community. So it's not the same old St. Croix EMS. And so as I'm making notes here on your overheads, under the discussion of full-time 7 paramedics and 7 EMTs, I wrote the next line is casuals to fill the vacation and sick time. Do we know how many casuals we need to fill these vacancy needs? And will these casuals all meet their 2-shift minimums per month if that's all that's left? You know what I mean? And those are part of those models that we have to look at. You're absolutely correct. As we move forward, I don't think you're going to get a consultant that's going to tell you that information. You almost have to live it. You know what I mean? And that's what we've been doing for years, is living the change that's been occurring as we grew from an ALS from a BLS to an ALS to where run volumes continued to increase. We've had to grow with that service and the communities around us. Do I want to pay $35 per capita, which is some of the charges in this state? No, I don't want to do that. So we've always worried about cost. And when you guys said you could reduce the cost and you didn't think that the other municipalities we were paying our fair share, we said we don't think so.
I'll challenge that statement. When did we say that we were going to reduce the cost? And when
In
did
the
we
very
say that
beginning.
we were-
In the very beginning. That was one of your goals.
No, as a
which you
goal,
said to
that
the
was,
council.
that was a goal. We didn't say we were going to do
wanted to
that.
do
There were
it
a number,
as a
excuse me, Tim.
no-cost option.
There were a number of other responsibilities on that list as well. And
Right.
we're looking at
But
costs.
I haven't seen us do anything to get to a no cost where it wouldn't cost the municipalities anything. That has not changed. That was one of your directives that you told the council you were gonna do in the very beginning. when you
I
approved.
do think that's totally incorrect. No cost option?
Yeah,
That was a goal.
it was a goal.
Looking at it, but, we
And you didn't need to change the costing model because you were gonna get there. That's the way I took that.
That was great you took it that way, but you need to go back and reread the.
Then we're gonna go back and
structure.
tell you need to pay your fair share.
Are you talking to the ad hoc committee or are you talking to the city council now?
The council. Because of the fact that you really
Yeah.
aren't paying your fair share.
Tim, I'd really like you to keep that as an issue separated from what we're trying to do. It is an important issue and has to be resolved, but the ad hoc committee is not.
Well, because I thought the ad hoc committee was
we are
gonna
not-
move in that direction to help that.
Absolutely not charged to do that. We don't have that responsibility or authority. And that's a separate negotiation that needs to take place. And I think we'll take the message back, say this has to happen, and make sure that we start on that.
I
But
hope your council agrees with the direction you're going as an ad hoc committee.
They, so Monday night, we talked about it, and they were supportive of doing the study. We didn't go into where the money was going to be coming from for the
Do
study.
you want anything out of the EMS commission for cost analysis on how you pay for it? A motion?
I guess we're looking for your recommendation, your thoughts on this
I think we
process.
should.
I guess what I would be looking for is looking for you guys to partner in with us, not from just a financial piece, but helping us solve it, look at different structures, be a part of that process to figure out who would we bring in to even look at this to begin with, and do that sort of interview process and be a part of that process instead of being outside of that process. So yes, a financial piece, but also being a part of the process to help us figure this out.
I don't have any problem with being part of the process, Bill. I don't.
Okay?
We need all of the municipalities involved in this, and we're going to need to involve your boards as well.
And remember, that's a change.
Yeah.
Because the last process, the other community, Rich will tell you that he worked with the communities, but he really didn't. He came and told us what was going to happen. So do we think that we were a part of that process before? No. So it's a different process, I agree.
And what
I
I'm
think you're
saying is
correct.
that we want you to
should
be a part of that
we should be
process.
part of that process.
Absolutely.
Because that's the only way, if in reality you want to go with a referendum, because that referendum has to be to all the municipalities. to
Correct.
pay for it.
Yes, we know that.
Brenda, do we get the money in our budget to fund this study?
We do have salary savings, as you heard earlier during the meeting, to help fund the study. So maybe one of, if the commission's not comfortable, if they have 100%, maybe the commission, or the St. Croix EMS can pick up half the cost, and the city pick up half the cost out of our general fund. But it's, because I do think that the study would help with the direction for St. Croix EMS.
I'm going to take just somewhat of a contrarian viewpoint here. I just feel compelled to say I'm not convinced that getting a consultant will tell us anything we don't already know. We've been at this for a long time. We hear, we know, we heard from you and the people you've talked to that the model itself, as it's structured today, it's not sustainable. That's what I'm hearing. And I challenge anyone to tell me I'm wrong. The model's not working. if it was working, we wouldn't be having these discussions.
I think you have to look, last year's model is the model we're talking about not working. The model we're on now is moving along in the direction of full-time employees. And that's a different model than, and we're trying to combine the two as we make that transition to manage costs.
And I'm not suggesting the model itself is flawed, but if we have to keep going round and round on the staffing issues and we can't seem to, it just doesn't seem sustainable. It's like hills and valleys here. I don't know, what would the consultant tell us that we don't already know? There's a lot of smart people in the room. We've got the commitment from all of the communities, and we've done a lot of diligence and a lot of research, and I thought your information was very valuable. What would they tell us? And why would we spend that money? What could they possibly tell us that we don't know already? We've done the research on the different models. Brandon has done an admirable job of trying to keep it together. He's working 5,500 plus hours kind of thing. And you've been doing that forever, right? So how is that going to change by getting a consultant? I don't see how that's going to help.
I think looking at it from 10 years down the road, 15 years down the road, as we grow as a community, would it make sense? Do we see ourselves going to a fire-based EMS? And I'm not suggesting that's the way that we would go, but I just think that right now the optics on this are just very narrow, and having a third party come in to just say, you know, here are different delivery, not models, but structures, ways of delivering the model would be a valuable information.
I think we've already kind of done that, haven't we? In terms of, we've had a lot of discussion around what other different models. I saw a presentation, I think we talked about 5 or 6 different models. And so we know what those models are. And I would bet you anything, the consultant's going to say, you need to come up with a different model. Well, we know that. And we know what the models are. And so I think it just, you know, we can do that, but I think we're just basically putting a lot of money into what we already know.
I just want to clarify, when you're saying models, are you saying the number of staffing? That type of model where it's paramed?
Well, we talked about...
or are you talking about the delivery of it?
The delivery of it. And or the current model, how do we get our staffing to support that model and those type of things. Correct me if I'm wrong, but we've had these discussions, haven't we?
And ironically, I think, yeah, we have. And I think ironically, as I'm sitting here listening to you, and I'm trying to put it all together in my mind, and that's, you're right, Tom. In some of the areas that we've discussed it, every time we come back to it, the model doesn't work. Why? Because every time we hire somebody and we finally get them trained and they're working well, what do? They leave. And why? Because they're going to better pay. Maybe the model ought to be looking at that we compete with the Twin City wage and figure out how to fund that so that we don't have people leaving. Because that's what's killing us, not the fact that our model doesn't work. It's the model doesn't work because of the staffing, because they're constantly leaving as fast as we get them trained and they're organized. Maybe that's what we ought to be doing, and a consultant ain't going to tell you that. I can guarantee you they won't. And the consultant may help you on the fact that you want to do a referendum. I'd be more supportive of the referendum and selling that process than I am to changing the model, because I think we can work through the model. Mm-hmm. I do.
Okay.
You know what I mean?
Well, that's one of the first steps, though. So when we consulted John Bucknell, the first thing that he said was, you need to have all of the numbers for the model for 5 years out, 10 years out, so that people know what it's going to cost. And that's the place to start.
And Rich said, when he was first starting to talk about changing the model and going with the hospital, it's not sustainable 5 years from now. And that's a true statement. That's not an idle statement. That's true for all municipalities. And as a consequence, we got to find a way to say, this is the model we think, best estimate is, this is the model of the future, and what is it going to cost us as a municipalities of this service for St. Croix EMS moving forward, and how do we fund that? That's where you ought to be heading. And maybe you're right. Maybe we don't need a consultant to do that.
I think that advantage or disadvantage that the ad hoc committee has had is that we hear from more people than you do. You know, that we were kind of a new group, so we were easy to shoot at, and we were easy to throw stuff at and say, whatever you felt, whatever you thought. And we heard a lot of that. And there are a lot of different opinions about how we should be structured. Now, I know strong opinions on at least 3 different models that are out there that we know about. This is the way we should be structured. And it doesn't particularly agree with my thoughts. But my only advantage is that we've been kind of involved in this fairly deeply for 8 months, and we've gotten a lot of input, and we've done some studying, so we have some sense of it. But our vast experience is like that compared to people who actually work in the field and who actually deal with other organizations who are going through this or trying to figure out how to survive. It may come down to, he may say, yep, you're right, for this organization, it's a municipal thing, will get us what you want or what we think people want. And it's totally a funding issue. Could come down to that. And then we have something we can go out and sell. And say, this is what it is. This is the story. We've done this work. You have no choice. If you want EMS service, this is what it's going to be. And if you want it at this level, if you want it 2 in the morning, you want someone to be 4 minutes away or maybe 15 minutes away as opposed to another 15 or 20 minutes, then this is what it's going to cost you.
And I agree. And I will point out, in the model change that Rich was moving forward to move into the hospital, he made a choice in that model to say we will not provide first responders. In all of the other municipalities that Lakeview works with, the municipalities provide first responders, so it doesn't matter necessarily how far your truck is away, and he chose not to provide that service. And that was, so he took the model and he almost destroyed it indirectly is what he did. And so every time we kept talking about it is, how do we get first responders? And it might have cost us the same thing for first responders that it was costing today, but it didn't move forward with the change of the future where that would have, Lakeview would have continued to provide that service and we wouldn't have seen the increase. So in some ways he didn't have a bad model. We made a bad choice with saying we will not provide first responders, and most of those communities do it through fire departments. And Rich says, no, we're not going to provide first responders with our fire department because it's going to cost us an increase in cost. Well, you might have just moved it from here to here, but you wouldn't have seen the increase that we're going to see with the model moving forward. And if we want a community level service, which we say we do, then it's going to cost us more.
I think as a point of practicality, it comes down to two choices. We try to fix the reasons why the current model is not working, or we try to change the model because we can't fix the reasons why the model is not working. Sure. And I don't think we need a consultant to tell us that. We know what those models are, and we know what the reasons are why we're struggling or having challenges with the current model. I think that's where our effort would be better served. That's just my opinion.
This all started, the ad hoc committee is how we were going to fund EMS, and we were supposed to have cost reductions. I mean, in the increasing the ability to pay, this model would work. I mean, you talk about people jumping from here to Woodbury or whatever, for EMS once they're trained. I just lost an officer from the village, came to Hudson. And I lost a public works or water department person, came to Hudson. For what reason? For more money. So that's the bottom line here, and that's the reason they're jumping around. I mean, a consultant is going to tell you what you pay them to tell that you want to hear. If you want it, if you're going to tell him, yeah, we don't think this model works, he hears that, and you're going to get paid $30,000, $40,000 down the toilet for the same information we already have. As far as, for the commission to be funding this, or the EMS to be funding this, I think is insane, and I would never vote for it.
I know you're greener than grass, Susan. But you are the representative from Troy. What's your thoughts?
Well,
Thank you, Tom.
you know, I don't think the EMS commission should pay the cost of a consultant. And, you know, there's referendum, I don't know, see, we have 2 EMS services, and, yeah, River Falls and Hudson. And the situation with a referendum in Troy is it would cost you a little money to have a referendum there, because you have to find out, you know, the area that that you're covering for us. And so the ballot would have to be, you know, that referendum just for those people. It's extra work for our clerk and, you know, our.
That's not the same
election
division
staff.
for where the school referendum went.
Yes.
It's a different line.
Or it's a different line. And also, we have another choice, you know, if the costs get too high, I mean, we could change our borders and do, you know, more business with River Falls, and we have to watch that because we can't go, you know, we can't do that too much because it takes longer to get there. And who wants, I mean, we don't want to impair the time that it takes to get to someone's house with the ambulance. So, you know, I think this is a Hudson issue. It is your EMS. And you have to come up with a model that works for you. It looks to me like you're headed toward full-time staff with a few part-time people that you're not a volunteer model. What the cost of that is, I don't know. I'm kind of green.
That's the first step, is to find that out.
Yeah, but I think that's where it's headed, and River Falls is headed in that direction too.
Was it $35 per capita?
31,
31.
yeah. And that was with option 1, calculated at 9 FTEs
Oh,
for
9
each,
instead of
because we're
7.
doing 36-hour weeks.
Okay.
So there should be some reduction there.
Reduction in there.
So what do you think it'd be per?
Still right around 30, right around that $30 mark.
Okay.
It's a big number.
Well, it's 7 of them.
And it's one thing if you could just raise your levy limit to cover it in your residents and say, yes, go ahead and cover it. It's another when you got to go to a referendum to say, it shouldn't be any different, but it is. The referendum, they go, no, I don't want my taxes increased.
But, you know, what you have to do is show the public how much that is in relationship to how much you pay in school tax and on the other things in your tax bill. It's
It's a lot of teaching. It's a lot of teaching.
Yeah, it's a lot smaller. And anybody that's had a serious issue knows how important this is to have an ambulance at their house to take care of that issue. So, you know, I mean, you got to have this service. It's going to cost more no matter what model you go with. It's going to cost us more with River Falls and Hudson. I am kind of green. I don't know what the costs are involved, but I don't think the municipalities that are using your service should share in the cost of exploring the best model for Hudson. And the thing is, Hudson needs I don't know, but I think they want to have us participate.
Yes.
To offset the cost, your costs. So,
But we wouldn't, but the study wouldn't be looking just at Hudson, it would be looking at the service area, the entire service area.
I don't understand that whatsoever. It'd be a service area?
service area can change.
Well, you know, town of Hudson, village of North Hudson, town of Troy, plus city of Hudson. Looking at what's the best model to cover all that is covered. And of course, Warren Township would be included in that as well.
And I agree with them. I don't think a consultant's going to tell you anything different than you already know. The reason for that is every time we need to change, we turn to Brandon or whoever is the chief, your director, and say, where do you think we need to go to change? And as we grew, we changed. And I think to that point, he's right. I don't think you need a consultant to tell you that. And I think you found out that there's a lot of stuff out there that's different. Example, when we looked at hiring a director from a nonprofit organization, he wanted $80,000 a year in salary. You got any supervisors in your town, in the city of Hudson, that are paying $80,000 per year? And that was
5 years.
when we hired Kim. So it's well over 5 years ago. That's probably $100,000 now. And that's a nonprofit. And so they're breaking even. Municipality's no different than a nonprofit. You're hoping to break even. The municipalities are covering the difference. That's all. So it's like we just want to get to a point that we can reasonably afford that, a model that works for us, and we'll just keep tweaking it till we find that. I believe. I don't think a consultant's going to tell anything any different. And I worked with a lot of consultants at Anderson, and I watched us change a lot of the stuff after they went out of town and told everybody what a wonderful job they did for us, and you'd have to change everything they screwed up. It took 6 months to a year and a half to fix. And so careful what we're doing when we're paying that $34,000 to look at a model that makes us change something that doesn't make any sense in the future. You know.
Yeah, well, what I hear is, one of the things I hear is that it's important to tell the, if you're working with a consultant, what are the answers, what questions do we want answers to?
And that's true.
So that's the, you know, how we develop that is going to be very important. So that's good. And I worked at 3M, so I experienced a lot of
you've
consultants
seen
as
them.
well.
We've all seen them.
And some had some good ideas, and some had some not good ideas. But
Ed Anderson, yeah.
So what I'm hearing is that you guys, as a commission, don't want to be partners within the consultants and will go and do our own thing?
I'm willing to
I just
work
want to clarify.
with you, Bill, on
Okay.
it as a municipality.
Okay.
I just don't think we ought to fund. I don't mind the 50-50. I didn't hear that from either one of them on the cost. You know.
No, I'd agree with you on the 50-50.
And as long as the staffing model takes care of that cost, it isn't as big an issue, but.
All I ask, though, is if a study is going to get done, and I've said it at other meetings, that something comes out of it. If we're going to spend the money to do a study, because I got 3 studies downstairs that we haven't done anything with.
And that's true, too. And that's very true.
Exactly.
That's very true.
And I'm hearing that loud and clear. I mean, if we're going to spend the money and we get a recommendation, let's
Are we
all
gonna
hold
try
hands
it or
and
say
do that
that's really
recommendation.
stupid? Yeah.
And that's something that I want to work towards. I'm very passionate about that.
So do you think there's really something out there that we don't know that you could get a consultant to do? And I'm asking this question and phrasing it with what he just said, that we would want to move forward to change to?
I think there's 2 possibilities. One is that the consultant will say, you're on the right track, and your issue is in fact funding, and
I've
this
seen
is the story
those
you have to
too,
sell.
yeah.
You know,
Yeah.
and in that case, then somebody from outside who has credibility, and my credibility doesn't go, you know, beyond this little space I'm standing in here.
I understand, yeah.
So we really need to be. This became such an emotional issue, and still is.
It did, yes.
That we really need to be able to diffuse that. You know, look at how many referendums the school board went through before they finally did the engagement process and brought people in. And I attended most of those meetings. It was amazing, the involvement that people had. And then they were able, you know, they said, yeah, we're willing to pay for it. Now, it always hurts when it comes back and actually hits you in the pocketbook. but they still liked the idea, and it was the best idea, and they knew it had to happen, and these were good choices. And we had involvement in the choices. You know, that was, so it was a reason that worked, and I think we need to do that. So,
All right.
thank you.
Do we got the answers we need to move forward?
The other thing that
'Cause we need to move on. We
and
got
Carol
another
came
meeting.
up with, that mentioned during the community engagement process, was that if you have a consultant, that you don't just hire a consultant and tell them to go off and do this study, that everybody, all of the stakeholders are involved, where you give the consultant an initial request, but that it gets, that as you get information, you incorporate it.
So if I understood everything now, you were given a charge from the council to go back and put together that list of what you're going to accomplish. Is that correct? With the
Right.
consultant?
Yes.
Okay. I'd like to see what that is too when you're done with that.
Okay. So there hasn't been a motion here.
No. I think it's better if we don't, frankly.
Okay.
Don't make a motion to, okay.
Unless you think we should.
Well, here's the deal. So
It gives direction for the
it
council.
all boils down to time. And I think you said this too, Brandon, at the last ad hoc meeting, is sooner that we can get this done, the better. So in my mind, so first step is coming to council and deciding to do an RFP, right? That next meeting is not this coming Monday, but the Monday after, right? Would love to be able to pitch that, but the direction that the council would have to take, they would have to know what the commission wants.
Okay.
And that's why I would like to see,
And the ad hoc committee
A
needs
motion.
that information as well.
Correct.
I think that we do need an official direction from the EMS Commission.
and by that doing this too, again, is going back and partnering with you guys. The last thing that we want to do is put an RFP out there, get a whole bunch of applicants come back and choose one. We want to go through an interview process, find out what are we going to learn? What do we want to learn? What do we want to gain? Who can we trust from a consultant end? I don't want to just blindly get a consultant. I want you guys to be a part of that if you want to be, because you guys know it better than I do.
Do you anticipate that only to be look at a model?
No,
structure
now,
as well.
Jim and I have some different opinions on things, but after talking to Ann Carroll, what she said was, first of all, before you hire this consultant, gather all of the questions that people have about the direction for EMS. So I've started a list of questions that I've got. You brought up, all right, how are we going to handle first responders? Those are the kinds of questions that we need to have listed so that when we go to a consultant, we've got that list and say, you know, these are the kinds of things that we need answers for.
Okay.
It's looking at the structures, not just the model.
But it's not at this point moving forward to look at a referendum?
If that's what the consultants think that we should do.
No,
the
what-
only reason for asking that question is that part of the cost model that you're moving forward with it or not? Or is that something we would look at later? If we find out that this is what the model is going to cost, now we need to look at a referendum possibility process.
Yeah, the direction that I heard from council the other night was that, so for example, Sarah Atkins Hoggett said, you know, the consultant could look at a half dozen options and pick the top three that we could bring back and used in the community engagement process.
Structures, not models.
Or structures.
Okay.
You see, okay.
And the difference between structures and models is what?
The structures would be the type of entity that would deliver the model. So, for example, a fire EMS structure, a hospital-based structure, a nonprofit structure.
And a model is what then?
Pardon?
A model is the same thing, isn't it?
The model is what we believe that the
Model
community-
of a paramed and EMT, that's what we mean by the model, right? It's the staffing
the
model.
staffing model. Mhm.
Staffing.
Staffing.
And that's the
Yes.
problem, staffing
Sorry.
and paying for staffing, and that's what we've been talking about. And you can't pay for staffing unless you're willing to raise the rates, right? And when we proposed to have, hey, how about the people that are using the service more pay their fair share? And that didn't fly with your council, so I'm sorry that, that the partners on this deal, you guys are using 70% of the service, and we're paying, well past what our useful rate is, user rate is. So, without entertaining some of those ideas, we could come up, that was the issue. We could come up with the money, but at 30, whatever per capita, it's like, no, let's go with, per capita plus run volume like we do with fire. But the council had no part of that. So this commission was like, what are we going to do?
And maybe your model of costing for the future needs to change on billing municipalities. We haven't even entertained that thought.
Say that one more time.
Whether the model for paying for fire is based on
Run volume.
run volume and value.
Right.
This is based on per capita. And Stan's point is, we don't have in our municipalities the hundreds of these 55 and older buildings, of which Medicare has a ton of those people in them, and yet that's the service level, and we're based on the number of people. And so the model maybe needs to change to cover what we're doing based on the number of calls that are being made to the municipality more than the number of people that are there.
Well, and that doesn't mention a couple of big annex properties that they're coming in with the multi-family and everything else up there too, and that's all going on in Hudson. That's, to me, that's the whole deal, is like, hey, our fair share? No.
It's just
There's a lot of senior housing multiple.
Yes, senior housing does, and I get it.
Yeah.
You don't necessarily get tax dollars out of some of those, they're nonprofit. However, your zoning allows for that to occur.
And we have the water supply and sewer coverage to.
Well, and when we tried to create a POD to allow that to happen up behind the hospital, the city annexed the land. So it wouldn't happen. And then
But they probably wouldn't have built without
they
sewer.
were building with a sewer. They were building
with
a sewer. And the only reason they took it was because the city had annexed the land.
Okay.
And that's after that was when Woodwinds was built. So not Woodwinds, Woodland
Presbyterian
Hills.
homes, yeah. Woodland Hills.
So it's just, the model needs to change maybe that way as far as funding.
Okay.
And that way you aren't just shuffling it a little bit. You may need to look at fully funding the model differently for paying for the service that we're all agreeing that we need.
All right, I would like to see a motion to do this so that we have a clear direction to the ad hoc committee and to the council.
Before that, I just want to ask one question because I'm newbie to this commission. The excess funds, if you broke out the excess funds, what percentage of each municipality goes into that fund?
When you talk excess funds, what funds are you talking about?
EMS.
The savings from the
Staffing.
right?
It would be
So what's the percentage breakout of City of Hudson's cost in that money?
about 50%, right?
And I think it's 49 for the city and 51.
From the other municipalities?
Between the other.
Yep.
Okay. And so you're asking for half of that, which we're already at a higher percentage, and then an additional 50%. So I guess I'm really wondering.
But remember,
Yeah?
you got 70% of the calls for 49% of the cost. And that was Stan's issue.
So,
You know what I mean? And so he's
Everybody's
saying, yeah, it is. It's all of our issues.
so we have 49% of the population, but we have 70% of the calls because of the senior
That's-
living facilities in the,
And those are the ones that are the Medicare and Medicaid people that we don't get a fair share in our mind. When Obama said, we're paying way too much for services, I'm going, where is that occurring? Because
Foreign countries.
nationwide, all EMS services are having trouble
yeah.
paying the bill.
Throughout the study, and I would like to make a motion, I guess.
Okay.
But before I do that, would you, all three of you, be willing to be a part of that interview process?
Yes,
Part of that
Yeah.
process of,
To interview a consultant?
yes.
I'm not voting for a consultant to be in, so I'm definitely no. I don't agree with it. I think it's a total waste of money. Tom said the same thing. I mean, he works, he's the hospital guy. Waste of money.
I know you're new to it.
Well, you're actually been here longer than Bill has.
It's the EMS
Here,
commission.
on
Oh,
EMS.
right, yeah.
Yeah.
Right.
Okay, so, it's Hudson's EMS. I mean, they should be interviewing the consultant. And I'm not crazy about paying for the consultant. Troy would not, we pay part of it, but I don't think that I want to be part of that interview process.
Can I just be clear that when I wouldn't envision that the city of Hudson would send a bill to the town of Troy for your portion of it, it would come out of the St. Croix EMS fund. I just want
Right.
to make sure that you're all clear on that.
Yeah, I'm aware.
Okay.
I don't think it should come out of our budget, though.
And that's what the discussion is. It's coming out of our budget.
I don't think we can take it into our budget.
And it's valid, because every time I turn around, I'll have somebody pick up this budget. And it's happened to us numerous times. You guys are in the negative. You're losing money. We're constantly told that as a commission. And the only reason we're not is because the municipalities are funding it. That's not a new situation. We've been told many times that we're losing it. We had a private meeting of the commission got beat up 10 years ago by the mayor because we were always in the red. And I'm sitting there listening to that thinking, what do you mean? The end of the year we really aren't, because the municipalities cover the difference. And it's so in my mind at that point, after I got beat up, I'm thinking the council and the mayor don't really understand the system.
Well,
Sorry, you don't.
now you've got,
You now better understand how
Yes.
St. Croix EMS is paid for.
well, and that was one of the goals, and
And you do, and
And now-
I agree you do.
thank you. I'm glad to hear that you recognize that. We've done a lot of hard work to understand this
Yes.
system, and I believe that Jim understands the system as well. So, anyway, all right. So, the direction from the EMS Commission is to figure out how the model would be funded by the municipalities. But what other direction do you want to give us?
Would you be a part of it?
I will. But it doesn't sound like the other municipalities want to be part of that process necessarily.
Don't want to pay for it either.
Okay. Well, I guess I'll make the motion to fund a study to look at all structures, all models, to find a solution for long-term EMS funding through the support of our partners, with the funds coming out of 50% out of the EMS. What is the funding source?
Budget.
St. Croix EMS Fund.
St. Croix EMS Fund, and 50% coming from the City of Hudson.
I'll second that. And just for the record, Tom couldn't have voted anyway.
Correct.
It's a financial.
It's a financial piece, yeah.
Any further discussion? All those in favor signify by saying aye.
Aye.
Opposed, like sign?
No.
Nay.
Fails, right?
2-2.
Two motion fails. Doesn't have a majority.
Okay, so our direction right now is to look at the financials for the model with 7 full-time paramedics, 7 full-time EMTs at various salary levels, and start from there. Okay, anything else that you want to
No.
give the ad hoc committee? Okay, thank you.
Thank you. We got to do this quickly because we got another meeting we were supposed to be at between 8:30 and 9.
Yep.
Tim, I can take 6, 7, 8, 10, and then I'll do 9 after 10, if that's cool with you.
Cool.
All right, so update on the billing RFP. We still don't have a contract yet.
Oh, really?
Sending it out for RFP was successful. We did get our rates reduced to 6%, and they are going to absorb all of our credit card processing fees. They are honoring the contract as of July 1st, even though our current contract expired, I believe it was the 10th, yesterday, I guess. So they are going to honor it, though, effective July.
What's the holdup? Just
They
curious.
have to redraft the whole contract, and our main point of contact's out on medical leave.
Oh, okay, got it.
That's where we're at with that. When we have a
So it's
completed
not a major issue.
No, when we have a completed contract, I'll make sure it's available for you guys to see, and it'll get reviewed by the city attorney. The RFP on facilities, we are still working on that. Initial numbers are coming in high at 850,000 right now. I hope to have final numbers by Friday and then present to the council on the 23rd. Michael Clark from 5 Bugles will be here as well that night if any of you guys want to attend. Update on the remount, that is in progress right now. We have a loaner truck. So if you see a plain white ambulance cruising around, that's ours. We've used it a few times on backup calls. And then update on the staffing model. So last meeting I reported that we had all 5 full-time positions filled. That lasted for about 2 weeks, and we had to release the 5th full-time person. The good news is I was able to find another individual to fill that, but I also had another one resign to go back to his previous employer for higher pay and what he determined were comparable benefits. So we're down to having 4
Released and 1
full-time.
left.
We're at 4 full-time right now.
Oof.
EMT staffing continues to be an issue. We brought on a couple of new people last night for orientation, and we have 2 that are still in ride-along status from the previous group. And
Ironically, as I sit and listen to this, it always comes back to one thing, and it's financial. We can't keep filling that full-time staffing model with the current model of pay. Really, is really what it boils down to. And we get to that discussion every time. You know, so we can come up with the 7 in part-time, and if we don't change the model of paying, we aren't going to keep them here. Sorry. And we've seen it for enough years to know that that ought to be a reality to us. Just a thought.
all right, and then number 9, just discussion on the 19 budget. Just wanted to get that on there, get you guys thinking about it. The 19 budget's still going to be an issue depending on what happens with the consultant or anything like that. We're still going to see an increase there. And the 19 staffing change, initially, since we're working towards the full-time staffing, we had added a paramedic each year. I'm seeing the need in the EMT area, so I propose to add 2 EMTs full-time versus a paramedic at that point in 19. So I just wanted you guys to be aware of
Can we
that.
operate with less than, at the full-time model that you're asking for, can we operate with less full-time staff than whatever model you're saying we're at? And you're saying we're supposed to be at 5 now, and we're supposed to be at 6 next year, and we got 4. Can we operate at that level?
With the way,
Without you guys working 3/4 of it now, and you see an increase in your hourly?
if we can get that 5th spot filled, yes.
And how do we fill it?
Right now, it's it's coming down to the dollar amount is what I'm hearing.
Whether
Always
you
been
hear
about
it
the dollar.
personally or they leave because they get a dollar amount.
Right.
I'm sorry, that, I hear that loud and clear. Whether I like it or not, I hear that loud and clear. And that's the same issues that River Falls is running into. They were losing students to Baldwin because they could make more money, you know? And so it's not something that's, shouldn't be a surprise to us, you know? And maybe we've got to bite the bullet and figure out how to fund that for the future. To keep people, because that's what's going to make the service work, is to keep people. Right?
Right.
Okay.
And so it's just an informational item. We'll probably have to do a special meeting in between to do
I
budget
agree
approval.
to do budgeting. Okay.
Just wanted to get that on there. We do not have a medical director update. For my update, I covered kind of the staffing there. We did have a recent theft. We lost about almost $10,000 worth of swift water equipment that was stolen from a trailer up at the Ward Avenue property.
Really?
Police report's been filed on that, and we haven't heard anything else as of right now.
Are we
The insurance claim will be made, yes.
so we're not self-insured, thank goodness. That was one of the issues when I was at Anderson. They were always self-insured, and it was like when it disappeared, it just disappeared.
So,
Okay.
in the interest of keeping it short, I think that's all I got.
Future agenda items. Minutes, financial report, ad hoc committee,
Budget?
budget. Well, hold it. That's a quarter. We need another meeting before we have our quarterly meeting, don't we, for budget? We're probably going to end up having to do the same thing with fire.
When would our next meeting be on the rotation?
And we are looking at
Yeah.
week of either September 10th.
Either one of those works fine. For me, I'm not here at all. I'm gone the 4th of September, and I do not return till the 22nd, so you'll have a meeting without me.
Where are you going?
Norway, Sweden, ultimately end up in Russia.
Nice.
Will there be somebody from town? Or should we look to move it to the week of the 24th?
Did we, remember we had those discussions about
I-
whether, did we ever finish that? I don't think we did we?
I'll have to go back and look.
I thought the council did approve that.
Alternates, yes.
Yeah,
Yep.
yeah.
I couldn't remember where we ended up with that, because during that whole process, we amended our bylaws, only to find out they didn't exist anymore.
So I think, yes, we approved that you could have.
That you
an
could have a
alternate.
representative here.
Yes.
Okay, so yes, there will be.
Okay.
That's why I did a funny look. I couldn't remember what happened.
Sure.
Okay, so we can have a representative here. I don't care the date.
I'm not available on Tuesday and Thursday mornings, starting at the end of August,
Okay,
so we have to do Wednesday.
Wednesday,
And it's 18th? Or, no.
19th, 12th or 19th,
19th.
whatever works for you guys.
12th
Wednesdays
is,
don't work for me.
Wednesdays don't work for you?
What days are best for you?
Pretty much any other day.
Jim Weber can give the ad hoc committee
Okay, you could do it.
report, but only to make sure that he's able to make it.
Tuesdays would work better for me.
So you're not gonna be here anyway.
No, but if we're looking at moving forward, if Wednesdays don't work for him,
Okay.
Well, should we just do it on the 25th?
we could do it on the
Yeah, why
25th.
don't we do that?
25th, okay.
That way you're here,
Yeah, okay,
or can be here, right?
yep,
7:30?
7:30. And we'll do budget then. Should have some pretty solid numbers by then. Because you will be able to work through your models.
Then we'll have final numbers on the facilities too, and know the direction on that.
Can you, on your chief's report, you didn't really cover it, and that's that medical director's report of doing that procedures for transfers. Can you cover that for the rest of the commission?
Yeah, and actually I did email the flow sheet to Joanne to send you guys. I just sent it to her. So you guys should be receiving that.
This one?
Yes. Yep. So that's the actual,
And I don't think he had a clue what you were talking about when you mentioned that.
so,
It shows the process that should occur at the hospital
Oh, right.
with when a transfer is going
Transfer
to
happens.
occur.
right.
And Brandon and I had talked about some other stuff, and that's why I happen to have a copy of it.
And so that's a hospital's directive as far as who they
Yeah,
are?
that's
the
an
medical
internal
director.
system. And then, glad you mentioned transfers. With staffing lately, we've actually been able to help out our neighboring communities and gone to other facilities and taken transfers out of those hospitals. Yes. So it's a good thing.
Awesome.
Westfields and River Falls, yeah.
Good. Okay. So chief's report, medical director's report, all the normal stuff we would have. Almost everything. Virtually everything that's on this one is going to be covered again.
One more thing I forgot under the chief's report is, being that we're going to be meeting quarterly, I will start sending you guys a monthly status report
That
for
would be
staffing,
nice.
call volume, et cetera.
Nice.
That way you'll have that.
When would we meet, since she left, to pick up the third quarter sometime in October or November maybe?
I think the plan was to do it in conjunction with the fire board meeting, so you guys are only attending one day.
No, as far as
So
the
the-
next meeting after that, so we'd pick up the third quarter.
So wouldn't it be whenever their quarterly meeting would be? Same day?
They've been determining that based on when we want to meet.
Okay.
And when Brenda is available with the numbers
Got
to
it.
do a quarterly report. Thank you. You got good ears. When would we be able to do the quarterly report for third quarter for fire and EMS? October? So maybe toward the 23rd of October? When we look at this, so we'll meet the 25th and then the 23rd of October. And the only reason for doing that is so that we have some we'll have some recommendations on budget and then have maybe the final approval for budget the 23rd of October. Okay, that's the only reason I was looking out, was to say, okay, where do we get, because the next one won't be till January or February then when we're going to meet to discuss the year-end report. Okay, I move we adjourn.
Second.
Motion been made second. All in favor, say aye.
Aye.
Aye. Thank you very much, everybody.